All right, well, we're going to get started with the session. We're really going to focus on what this vision looks like, and our panelists today are really excited to have them here, really thought leaders in their domains, and really look forward to what they're going to share as well as your continued engagement in the discussion. So on our panel, we have Joyce Sensmeier, who, from a nursing informatics perspective, Vice President of Informatics for HIMSS. We also have Gregory, as mentioned before, from SSR, and Tim Gee, who will give us a phenomenal point of view on medical device integration. So without further ado, I'll turn it over to the panel.
Thank you. Sure. Can you hear me okay? Mm-hmm. Okay, great. Well, it's my pleasure to be here. I bring content information from the national perspective, and my point of view, besides nursing informatics, is threefold. One is leadership, the second is connectivity, and the third is patient safety. And in no way is that my priority. Patient safety is always first. But that's kind of the framework. It's a pleasure for me to be able to experience what is going on at the local, regional, and state level. I work mostly at the national level, so it really takes me away from the day-to-day. And this summit is as important to me as it sounds like it is to you, to hear what the challenges are and the opportunities are for us really to work together to improve patient care. So in the first area of leadership, there was a landmark report done by the Institute of Medicine, the first time they focused on nursing, purely nursing. And it talked about the future of nursing and the opportunities that there are for nurses to make a difference in the transformation of healthcare and truly of our nation. And it sounds like this organization, specifically Texas Children's, and a number of you, probably all of you, understand the importance of that voice. Nurses work with patients, constantly and understand that perspective. But when you add the informatics layer and we learn the IT component, it's just a great package to bring to the table to provide a perspective that wasn't there previously. And then when you think about the next wave of healthcare reform and the focus that we will have on outcomes and metrics and the value of healthcare, again, it's very important not just to have nurses at the table, but all clinicians who understand the patient experience and can help inform those outcomes. So it's very exciting times we have ahead of us. So nursing informatics has been around for a while. I kind of remember when it was, I do remember when it was founded. Hard to believe how fast those decades go by, but it was probably late 80s, early 90s, where some of you maybe weren't even born yet, but it was exciting to me to find that what I was doing was really a specialty within nursing. So I was working in a hospital, working in med-surg, and then in nursing education, and they were going to implement a new electronic health record system. Of course, back then it was a mainframe with light pens and menus. So I was asked to do the training for the hospital system. And I said, oh, that sounds like an interesting project. Sure, I'll do that. Well, certainly ignorance was bliss, but it launched a whole career for me, and nursing informatics was being formed at the same time. So there is value in looking at what the competencies are that informatics nurses bring. And HIMSS has published, I'll talk a little bit about HIMSS in a minute, but suffice it to say that based on the Institute of Medicine report and talking about the value of nursing, HIMSS took that and developed a position statement that we now leverage in many conversations to talk about why you need informatics nurses at the table. And I wanted to share with you a couple of the key points to have the nurse's role in EHR technology adoption. So nursing informatics should first of all partner with the CNOs. So what have we seen today? The first guests at the table up here were the leading nurses in the organization, and they were the first to say that informatics wasn't their sweet spot. But now we have chief nursing information officers that can partner with the CNOs to really help lead these efforts and have the technology skills and understanding of informatics to help with the efforts. So those partnerships are important when you're leading transformations like the one that has happened in this organization, major change. The second is that nurses can help embrace technology that is interoperable, patient-centric, user-friendly, and focused on quality outcomes. It's difficult to see that from the videos. I mean, those were really an eye-opener to me. And after the third one, I just sat back to Tim and I said, wow. And that wasn't a good wow. It was, how in the world do we do that? But nurses understand why it's important to weave technology in a way that makes sense, to make sure that the devices are interconnected with the EHR so that you can benefit from the data that's in the EHR. So very important points to be thinking about: the interoperability component. Someone mentioned human factors, the usability component. If the nurse is having to access that technology quickly and focus on the patient, it needs to be user-friendly. And thirdly, nurses, informatics nurses specifically, should partner with vendors. And it's great to see our partners in the room gathered around providing the tools and resources that we need to do our jobs. But the conversation needs to be there at the table between nurses and vendors to make sure that design is interoperable, user-friendly, etc., and safe at the end of the day, and that nurses are working in those organizations to do the testing to make sure that when those tools and resources get delivered, they are ready to go. They are safe. When you implement them, there are nurses there making sure that the testing is done with the technology and with the workflow to make sure there's not a negative impact on patient care. So the second part of leadership is HIMSS, and that is the organization that I work for. They recruited me from the hospital environment because they wanted to make sure that they were understanding the patient care environment as it relates to technology. So HIMSS is a global organization, over 50 years old, that focuses on the best use of information technology to improve outcomes. And we now have over 53,000 individual members, over, let's see, I have to look because it changes all the time, 600 corporate members, and about 250 organizational members, like hospitals and health systems. And we work together to make sure that we all have the information we need to do our jobs well. So it's a not-for-profit association, I guess you could say, professional society. And what is exciting to me is the mission that we live out and that we use our resources for is better health through information technology. How many of you have been to one of the HIMSS conferences, or even you have a local chapter in the area? Have you been to one of their meetings? A number of you. Great. Well, if you were in New Orleans, you were with 35,000 of your closest friends and 1,000 of your probably vendors and exhibitors here that are all in one place having amazing conversations. So I encourage you to dip your finger into that. And there is a pre-symposium focused on nursing informatics for those of you that are nurses in the audience. The other important thing I think is working together with your colleagues, whether you're a member of HIMSS, a local chapter, national or not, making sure that you reach out to the community that is your partners in crime, so to speak, to make sure that you're learning. It sounded like you have a great strategy here at Texas Children's focused on the huddle concept. I love that idea. 15 minutes a day, focused on what are the most important things we need to know. You can take that and expand that idea to work with your nurse colleagues across multiple organizations so that you're really hearing the buzz about what is going on and how you can address it. And you'll get some of that, I'm sure, through social media and blogs and through your email lists. But that sounded like a really nice opportunity to work collaboratively. Okay, then the second area of my perspective is connectivity. HIMSS has been very successful financially, and because it is not for profit, it gives back. And so we are able to fund projects and efforts that help to advance health information technology in the right way. And one of those is integrating the healthcare enterprise. That is really an international organization that HIMSS has helped to sponsor and move forward that has developed a framework for interoperability that is standards-based, and it is freely available for your vendors to download and apply to their products. And we now have a focus in the U.S. to take that international framework and apply it more locally to solve the problems that we have here for interoperability, and we're working closely with the national initiatives like the Standards and Interoperability Framework out of the Office of the National Coordinator. So I wanted to make you aware of that project and that effort because I think it can help you in the real world environment. And I'll give you one example. This past weekend, I was at the AMI conference, and I heard a couple of you were there as well. So that's the Association for the Advancement of Medical Instrumentation, so the medical device, clinical engineering groups. And a lot of the conversation was about integration with the EHR. And I went to one session and heard a story about a medical error that was caused when a nurse accidentally did math that was not accurate and calculated the infusion pump rate to go in a period of 4 hours rather than 4 days. And the patient ended up dying as a result of that error. And a lot of the session was focused on, really it's not about blaming the nurse, it's about what all contributed to that horrible situation. Then I went to the exhibit floor and I saw a demonstration of IHE, Integrating the Healthcare Enterprise, and there is a specific profile that is developed to enable the barcoded medication administration information to go directly to the infusion pump in an integrated way. And that way, the systems would calculate the infusion rate, and the nurse, of course, would have to double check that to make sure it was accurate, but she at least wouldn't have to be, she or he, sitting at a table with pen and paper doing the math. So there are things that are being developed, and I know Tim will go into this in much more detail of what is out there to help with this integration challenge, which is huge and very, very important. And we can, as we know and learn about these frameworks and standards and capabilities, we can leverage them as we move forward. And then my third point of view is the area of patient safety. Clinicians get it innately because of our training. Each of us gets it because we are either a patient or a caregiver or we have a family member that has a challenge. I think in the world of IT, the IT folks are also getting it because we're partnering with them and we're reminding them. And I can remember when I first went to the IT department, I had to explain what a stat was. Well, why do we need a stat immediately? Because a patient's life is hanging in the balance. And those kinds of conversations occurred every single day. There were times when I brought the IT programmers up to the patient unit just to show them, how fast-paced it is and why the systems have to be 100% accurate. Of course, then I had to go back and test those systems, and I found out why it's hard to get those systems to be 100% accurate. But every time I brought a programmer, in those days they were programmers, up to the units, they just really sweated. They said, "You got to get me out of here. I can't handle this," because there's just so much activity going on in what then was the nursing station and now is more around the patient care units. So that's one key point. The other I wanted to share with you, and I don't know if you've seen the top 10 health technology standards for 2013 by the ECRI Institute. Well, they publish this every year, and it came out in January, and I heard about it at this AMI conference. And what was interesting to me is that 6 of the top 10 impact clinicians. And I'm sure the others, well, I shouldn't say that, informatics clinicians. So we have the opportunity to make a difference in mitigating some of these health technology hazards. So guess what the number one health technology hazard is? Alarms. Exactly. Alarms. Alarm hazards. And what this report does, and you can go and download it for free on the ECRI website. ECRI is an institute that monitors safety globally, develops tools and resources, publications around the topic, does research, and so this is the result of their research. It's not just, a list that they came up with off the top of their heads, by the way. So anyhow, you can go and download this report, and it gives a lot of information about how you can develop alarm management and really help to address the needless alarms, the alarm fatigue. In one case, one institution was able to reduce their alarms by 47% and get it to the sweet spot of what is the right number of alarms and what do you really need to act on. Second one, oh boy, this is kind of small. Medication administration errors using infusion pumps. What I just described, that situation, critical one. The number 4 hazard, was patient data mismatches in the EHR and other health IT systems. So a challenge of integration is definitely making sure you've got the right patient. The pumps, the devices are now at times wireless. They're moving to different places. The patient's moving. Are you making sure that everything is in sync and the data is actually on the right patient? Interoperability failures with medical devices and health IT systems. Again, just spoke about the challenges of that opportunity for fixing that area. Number 7 was inattention to the needs of pediatric patients when using adult technologies. No surprise to this room, but hey, you made the top 10. I'm sure many of you in this room have a wealth of information about how to address that and why it's important. And then the number 9 technology hazard was caregiver distractions from smartphones and other mobile devices. Well, there's your title for your videos over there. So it's really, I think, wonderful to see that there are resources out there for us to leverage to make our jobs make a difference and to improve patient care and address patient safety. And I think, in summary, really embracing that technology that is interoperable, patient-centric, user-friendly, and focused on quality outcomes is really what I feel we should all be all about, and wanted to make sure that I shared with you today. Thank you.